Hey, it's Dr. Joe again. Welcome to the Health Reset Workshop. We have here Uncover the Cause, Activate the Plan, and Reclaim Your Health through Chiropractic Biophysics. I'm going to explain what those mean, but the most important thing that I want you to know is that we care significantly about your health and your family's health. So everything we're going to do right now is going to be the foundation so that you know exactly what's coming as we go through the rest of the program. So I want to give you a little background on a couple of things. So we're going to start with a story. Here's my friend Henry. He had shoulder pain and lower back pain, which is very common with a lot of people, but he also had leg weakness and balance issues. So it started to realize that it wasn't just a back issue, something else was going on with his legs. Then they found out that as time went on, he had no feeling in his feet. So now we really start wondering, where is this problem coming from? The doctors did a lot of different things and they couldn't really figure out where it was. That's all they knew is they had some arthritis in his spine, which a lot of people do. Then he started noticing bladder dysfunction, and as that all went on, his sleep started getting significantly more disturbed, obviously with bladder dysfunction, so he went months and months and months with no sleep, which became a big problem. You can imagine if you don't get one good night of sleep, imagine several months strung together. Then he started using a walker because everything started to go so downhill very quickly. But here's what Henry's x-ray looked like. Now you've seen your x-rays, you know what a good x-ray looks like as far as what this green line is here. This is the normal, strong, healthy spine. The red line is Henry's spine, and you can see what his normal posture looked like. So he's using a walker, and now you start to wonder, oh, all of those things that we just covered, this is his posture. His posture was dictating a lot of what was actually going on with his health, and I'm going to explain what that means. But if I look at this x-ray and I look at all of these things, are nutritional supplements going to help his posture? Probably not. There's no nutritional supplement that I'm aware of that is going to magically change posture. All the other doctors that he went to didn't mention his posture. All of the other places that he had been, posture never came into the question. We looked at this and said there's something going on here and it may be related to this specific posture. Now we're going to visit this in a little while, but I want to go over why we started to notice that his posture was the key to everything that I just told you about. All right. The first thing is that if you think of a spine, if I told you just to picture a spine in your brain, you're going to realize that you think of it either straight up and down, which is correct, or if you turn to the side, you think of it with curves in it, and that's very important. Your spine is your lifeline. That means that your spinal cord is coming out of your brain and running down the spine, down the rest of your spine, all the way down to your tailbone, but it has all these nerves that are coming off of it into other parts of your body. They're all right here. You may have seen this poster when we did our first adjustment. I showed you exactly where we were talking about those misalignments, right? Well, all of this lifeline is powering your entire body. It's powering your lungs, it's powering your digestion, it's powering your bladder, it's powering everything. If that lifeline is starting to get compromised in any way, you can imagine that it's like a dimmer switch going to the rest of your body. That was our first clue as to what was going on with Henry as far as what is actually happening with him. It wasn't just this collection of things. We started looking at it and saying, I think we have a lifeline issue going on here. Now, there's a lot of talk about longevity, but it begins with your spine because, as I said, your spine is your lifeline, but the most important thing, if you get nothing else right now, it's this. The amount of energy running down your spine determines whether you are moving toward health or toward disease. So think of it this way. If I just said to you right now, take a number from 0, which is disease, sickness, death, or 10, and that is health, longevity, feeling amazing, strong. Where are you right now? You don't have to just think about it. Just figure out where you are. Now, the other question with that is, which direction are you moving? Are you moving toward the disease sick way, or are you moving toward the healthy strong way? Now, you can think of it in terms of the last month, You could think of it in terms of the last year. You could think of it in terms of the last 5 years. What's been going on with you as far as where you've been moving along that line? We're going to make sure that you're not moving down that way anymore. You have to be moving forward. Aging does not automatically cause you to start moving this way. I know I have a patient who is 90 years old and plays golf 3 days a week. But I also have a 50-year-old patient who got into 7 motorcycle accidents, and the 90-year-old spine looks much better over here than the 50-year-old spine over here. So aging doesn't equal decline. Neglect is what is causing decline. So we're going to avoid the neglect for you in the future. You're going to know exactly what to do. But what you do now is going to determine the strength or the weakness of your spine for years to come. So right now is a decision point, and I'm glad that we're doing this right now, because this is going to give you all of the information needed to know that you're going to get stronger, and we're going to show you how that's going to happen. If we look at these 2 pictures of the girl here, I want you to stand up right now, and I want you to stand nice and straight like she is right here. And I want you to take a big, deep breath in. Okay, now you felt how deep and easy the breath went in. Now I want you to stand like she is here, crunched up, folded in, and now I want you to take a deep breath in. And notice the difference, all right? So what changed was not that she was in more pain, and you noticed for yourself, it wasn't that you got into more pain. What it was is that your function decreased. And that's the most important thing to note right now, is health is not the absence of pain, it's the presence of function. We look at it as you are healthy, the more functional you are. Like I said, 90-year-old patient playing golf 3 days a week is functional, he's healthy. 50-year-old patient that can't get out of bed, not healthy, not functional. We see just by changing the posture that your function can change. The function of your lungs just changed in just that short amount of time. Now, are there lots of ways you go into this posture? Most likely. Let's think of things like computers, let's think of your phones, let's think of sometimes even the way that you sit on your bed and read at night. All of these are creating this posture, right? Chiropractic care is one of the most powerful tools we have to restore your function back to the greatness that it should be. And I'm going to help you with that right now. The nervous system is the connection point between everything in your body. Let's look at it. Brain goes into spine, goes into body. Brain turns into spinal cord has all the nerves that are firing out to all of your organs, your muscles, your tissues, your cells in your body. Misalignments mean that there is neurological interference. It means that your nerves are not functioning right. So if you have bones that are misaligned, sometimes it's one bone, sometimes it's a section of bones, sometimes it's your whole spine that is actually misaligned. And you can think about your own x-rays, right? Where were you compared to the green line that we showed you? Let's take what that means from a personal standpoint. Misalignment in my case meant that the first time that I went to the chiropractor, I was brought there by my mom with asthma, not with back pain, not with neck pain, asthma. 12 years of being in and out of the hospital, not knowing what to do. By the time I was 17, I was on 5 medications. 5 of them at 17 years old. I went to the chiropractor for the first time. He said, "Oh my goodness, look at this bone right there." When we looked at the x-rays, that bone was, instead of sitting like this, it was tipped down like this. Immediately we realized that that's one of the main connection points to the lungs. And if you have dysfunction in the lungs, here's what it says on this list: asthma, shortness of breath, tightness in the chest, coughing, bronchitis, pneumonia. That was basically the first 17 years of my life. I went to the chiropractor, and in 1 month, I was off of 4 of the 5 medications that I was on. He said, "Let's do another month of care," and that's exactly what we did. 3 days a week I went for the first month, 3 days for the second month, and I got off of that last medication. And since then, I've never been on a daily medication for asthma, and I'm still doing great to this day. That changed my life. I had misalignments. I had neurological interference. I was that person, that girl on the left. But the breathing was the functional part that I was having the problem with because of my neurological interference. That is not a back issue, that's a life issue. My life was literally being dimmed, and I didn't have the back pain or the neck pain that a lot of people do. Those misalignments have a name. They're called subluxation. You've now heard it from us several times. If you're here, one of two things have happened, if not both. They have been undetected, which means that they're either asymptomatic, or a lot of people will have just been taking medication to dull the symptoms, which is very common, or they've been uncorrected, which means that maybe you've been to other chiropractors and they either never took x-rays or they never discussed posture in the depth that we are discussing it here. So those subluxations are what is creating that reduction in your nerve flow, which is, you talked with our doctors here about all the different things that are going on in your health history. That's what we look at and say, where are your misalignments? Where are your subluxations? Where are those nerves being turned down or dimmed in that sense? Let's talk about the healthcare system. Here's what you're not being told. We have a lot of backwards priorities. Insurance pays for crisis care. They don't pay for prevention. They pay for things like when you go into the hospital, but if you went to your doctor and said, hey, I want to actually go through a preventive healthcare plan for the next 5 years, they are not interested in paying for that. Wellness is not profitable. They will pay for pills, they'll pay for surgeries, right? But they're not going to pay for a wellness program for you. They don't even do that in most cases. That's not really a thing. They'll pay for the wheelchair and not the walk. There's a perfect example, right? Here's the real issue. The system is profiting from your decline. We spend the most money on healthcare in the United States by far, opposed to the rest of the world. We are getting about the 37th best system right now. So we have a major gap in what we pay to what we actually are getting. We are not looking at the crisis part of this. We're trying to identify where is healthcare. We are not doing a good job of using our dollars for healthcare. We are using it for sick care. We don't want to use it for sick care anymore. We want to push ourselves and our dollars toward health and away from sickness. Make sure we're looking at that. A stronger spine means that you are more free. Chiropractic biophysics is the technique that we do here with all of these different machines and tables and things that you just saw when you walked in. There's a reason for that, because we are trying to give you a way to break out of the dependency of that healthcare system. Here's the thing. You've probably been trained to think that your body is a fragile thing and that it's not powerful. I mean, think of how many commercials that we see for, if you're watching something, and think of how many commercials that you see for medications, for example. Listen, we don't have headaches because we have a lack of Tylenol in our system, correct? We have headaches for some other reason. So your body is very powerful. Think about when you cut your finger when you were a kid, let's say. You didn't bleed to death when you were 3. You scabbed up and your body figured out how to heal itself. It is that powerful, and it's doing it on a regular basis every minute of every day from the things that you put into your body, sun exposure, all those things. Your body is powerful. It's not fragile. Well, choosing to strengthen your posture is not just about your spine. It's about taking your power back and moving you away from that sickness point and into that health point. It is not about just your back, it's about your lifeline. It's about strengthening that spinal cord and making sure that the energy that's going down and up is flowing as fast as it possibly can. This is like saying, I am refusing to wait for disease to show up before I take action. We've all got people in our lives that waited too long for something. We've got people in our lives that waited to do something or never knew about it and found out way too late. You can be proactive right now and make a big decision about how you approach the rest of your life as far as what your health is going to be, not how you're going to approach sickness. There's a big difference. How do we help reset your health? Step 1, you did with our doctors here. We went through the exam, the x-rays, the digital posture pictures, so that we can understand your baseline. When we look at that, we also know from your baseline, how far are your deviations away from a normal, right? So for example, if I look at a posture like this, I know that I'm not in a good line. I need to be able to do something to bring it to a neutral. So we wanted to see how far away you were from a normal. The next thing is corrective exercises and mirror image adjustments. So you probably saw with the adjustment that we did that it was a little bit different. And the idea was that we are doing the adjustment to strengthen your posture with everything that we do in this office. So the first thing, you also probably noticed that there were people on walls with blocks and they were doing exercises. We are trying to strengthen what we call the mirror image. Again, if your posture is going like this, we want to teach it to get stronger this way so it meets in the middle. If your head is going like this, we need to get it stronger this way so it meets in the middle. Everything we do is going to be to strengthen the opposite, strengthen the mirror image. So that starts with the exercises. It also starts with the adjustments that we're going to do because we're retraining the body. The next step, corrective traction. That's where all of these tables and things come in. We are creating a change not only in the bones and the structure in the whole posture, but more importantly to make sure that you hold that posture is to strengthen these tiny little ligaments that are in between each of the bones. If they just stretch a little bit one day and a little bit the next day and a little bit the next day, every day that you do that and you pile on another day and another day, that's how you're actually going to be able to create the posture that we're looking to get. So we're not just looking at it from how do we move all of the bones, it's really how do we move the ligaments is what we're trying to do. We're going to give you step 4, which is at-home rehab to reinforce and accelerate those results. I'll go over that in a second. And step 5 is checking your progress. We're going to do x-rays and re-exams. We're going to do a re-exam approximately every 12 visits with you, and then we're going to do x-rays. After 3 of those re-exams, we're going to actually re-x-ray you and see, all right, what kind of progress did we make? Here's my first set of x-rays. Here's my second set of x-rays. How did I do? What else do we need to do? How far along the process am I? We're going to show you exactly where you are there. All right? So the easiest path to success. How do I get the best results possible in the fastest and the shortest amount of time? 3 very simple rules. It's like a stool, 3-legged stool. The first one is adjustments and rhythm. Most times we start off with 3 days a week in this office. If you think about what 3 days a week, if you went to the gym the same 3 days, your body would get so excited because it knows, all right, Monday's my day. I'm going to clear out the weekend and we're going to start fresh on Monday. We're going to give it a nice booster on Wednesday, and then on Friday we're going to get you set into the weekend. That would be the gym schedule. We do something similar here. We try for Monday, Wednesday, Thursday, let's say. The more rhythm that you keep that in, meaning that the more that you keep those days as your days, your body will do the same thing. It will start to accept it and get happy and say, all right, I'm healing today, I'm healing today, I'm healing today. And it's taking another step into that healing process each day that you're here. Leg 2 is the at-home protocol. Now, using the gym analogy again, if you went to the gym 6 days a week, there's a big difference between going 3 days a week. You might be able to hit things a lot differently. We're going to try to do the same thing here. So we may have you here 3 days a week, but we need 3 other days to be able to keep training your body to say, don't go back to the old house. We still want this new house here, so keep going in that direction. And as we do that, we have the adjustments and the traction, the exercise we're going to do here. We're going to give you things to do at home that are going to mimic what we're doing with the equipment in here. So we're actually going to give you a kit that you're going to be able to use to do similar things that you're doing in the office, so your brain continually gets the information that it needs to say, I never want to go back to the old house of disease and sickness again. I only want to stay in the new house of health and longevity over here. Third one is breaking your bad habits. We all maybe sit at a computer, look at our phones, sleep, driving maybe. All of these habits are either helping you move this way or they're helping you move that way. And it can be something as simple as having your computer in the wrong position. There's a big difference between, let's say, how somebody would sit at a laptop versus a desktop. When you come in, some of these first initial days, immediately, we're going to start looking at your habits and we're going to figure out how we can break those habits for you. How do you sleep? Are you sleeping in a good, positive way, or are you sleeping in a way that's actually going to affect you in a negative way? How do you sit at the computer? All of these things we're going to kind of touch on for you to make sure that you are getting the best and strongest posture in all of those things that you do. It's one of the key cornerstones here that we make sure that you are not losing out on this, because if you don't break your bad habits, the other two are not going to work very well. If you don't get your adjustments in rhythm, you could do very well as you're sleeping, but if you're not coming when you're supposed to, you're not getting results. If you come for your adjustments and you break your habits, but you don't do your home rehab, we already know you're not going to get the results that you're looking for. So we call it a three-legged stool for a reason, and all of those work together in conjunction with each other. The real impact is this. It's a short period of time that we're going to do this correction, but there are going to be decades of improved function for yourself. And just some of the Google reviews that I pulled out and put on here, just a couple of quotes. Here's somebody that said, "I am a different person." Here's somebody that said, "I'm more excited about my future than I have been in 30 years. 30 years. Here's someone that said, "My stress has been reduced." Can you magically reduce your stress? No. But you can be much more adaptable to the stress that's coming in around you and say, you know what, that didn't bother me. It didn't bother my mental health. It didn't bother my spiritual health. And it didn't bother my physical health. And that's what this person said. You've all given me a new hope and made my treatment experience fun. We're going toward health. We are going toward a healthy life. We are never looking backward at sickness. This is healthcare in this office. This is only about you getting healthy. We don't talk about sickness. We only talk about how you can get healthy, and all of the things that we're going to do today not only are going to help you with that, but they're going to help you with your future as well. The cost of waiting. So degeneration that you may have seen on your x-ray, depending on what you have on your x-ray, that will accelerate. Normal aging versus accelerated aging. We've been to nursing homes. We all have. Is everybody looking at the ceiling? No. Where are they? They're looking down and they're bent forward. We already know from research studies that if you start just tipping forward a little bit, gravity is going to win, and it's really going to accelerate how fast you go down. We want to give you the strength immediately right now so that you never get to that point. How much longer are you willing to wait? You may have been dealing with things, like I said, a short time or a very long time. And think back to your own history. How long have you been doing these things? We want to make sure that you're not waiting any longer. This is the decision point right now. Your spine is your life channel. If it's distorted, your life is distorted. If it's aligned, energy flows, organs work better, your pain fades, your sleep improves, and you feel like you again. And when I say you feel like you again, go back to when the last time you felt like you. How long ago was it? How did you feel when you felt that way? That was way over here, but in time, you've gone this way. We want to get you back over here as fast as possible. So let's go back to Henry for a second. So this was Henry's picture, his x-ray, same one I showed you before. And you saw, again, he was using a walker. He had bladder dysfunction. He had all kinds of issues going on with his tingling in his feet, shoulder pain, back pain. His lifeline was completely distorted. His life channel that he was getting energy, as you now know, top to bottom, nothing was working the way it was supposed to. So with the corrective work that we do to try to get his posture back, we said, what is it that we can do to help him? And we looked, and over a short period of time, 4 months in his case, this is Henry's posture now. We closed that gap for him, and we have him standing upright. Here's the thing, at this point, Henry is 89 years old. So a couple of important things with this. Number one, can you change posture for older people? Yes, you can. The other thing is that if in a case like his, he was headed toward assisted living or a nursing home. His family was starting to think about it, and what we did with the work that we were able to do for him, got him more upright. He's still a patient. He says, told me the other day, he said, every year that I've been here, I am healthier and stronger than I've been from the year before. It's an amazing testimonial to hear from somebody that's now in his 90s. So now, showing those postures, like I said, nutritional supplements are not going to change posture. We already know that. Will physical therapy change posture? I love PT. I think it's great for certain things as far as rehabbing joints. When it comes to posture, the one thing we say is do this first. If you want to do PT, if you're looking at it, go in strengthening a good structure instead of a bad structure. We want the good, not the bad, and now PT becomes much more effective. Medical doctors, have you ever talked to your medical doctor about posture? Or actually, let's say it this way, has your medical doctor ever talked to you about posture? Probably not. That's not one of their focal points. How about going to the gym or yoga or Pilates? You're going to get stronger, but again, are you strengthening a good posture or a bad posture? You could be getting much better benefits and much better gains if your posture, let's say if you're going into the gym with this posture, you're just strengthening this. You need to be strengthening this. Massage, can massage help? Well, it's not going to change your posture, but if you're in something like what we're doing, if you're getting regular massages, you're actually helping us. You're being able to give your body the relaxation of those muscles that we're trying to get to a point where they can calm down as well and make your posture get into that proper direction. Other chiropractors, well, if you're here, I'm going to bet that other chiropractors have not told you about your posture, have not looked at it in the same way we are, and even if they looked at it, they didn't do anything about it because that's what we saw in your x-rays. So this is all the equipment. We know you are in the right place to be able to handle this right now, to be able to get your health in the right direction. Now that you know, one thing that's really important is the changes that go on with posture or the degeneration of the spine is silent. It's like cavities. It's not something that you're going to feel until it's too late. So don't be too late. Have you set an appointment for your spouse yet? Have you set an appointment for your kids? I say kids because children's habits determine their future health. Think about kids right now. I mean, if you think about a typical 12 or 13-year-old looking at their phone, they don't just look at it like this. It's a full contact sport where they do this. Not a surprise. We're seeing higher rates of asthma, crunching, and we're seeing higher rates of digestive issues, crunching, from, in my opinion, the phone use, the tablet use, because they're not just sitting upright and doing what they should be doing. They're sitting and crunching everything. So we look at the kids as the key to being able to break some generational patterns. How do I know they're generational patterns? This is a mom and this is a 13-year-old son. And you can see real clearly that they have a very similar pattern. We are trying to get his pattern broken. She didn't break her pattern until too late. She does not want her 13-year-old to have the same issues she did. So health is generational. Get your loved ones checked. So please talk to us when you're here about who else you want to get your spine checked. We want to help as many people as we possibly can. And it starts with us, it starts with you, it starts with your family, it starts with coworkers, it starts with extended family. Everybody that you know has a spine, and everybody that you know deserves to get their spine checked to see exactly where they stand right now and where are they in terms of that timeline that I showed you. Are we going closer to 0 or are we going closer to 10? Everybody deserves that chance, all right? So that's our reset workshop. What are we gonna do from here? When you come in the next time, we are going to go over your individualized recommendations. Everybody has a different spine, so we have tailored recommendations for you, and we're going to go over those with you, and we're going to show you exactly how we're going to help you not only get better right now, but recover your health for the future. I look forward to seeing you the next time you're in.